Low-carb diets have been touted as a potential solution for managing and treating various health conditions, including diabetes and heart disease. These diets work by limiting carbohydrate intake and promoting higher consumption of protein and healthy fats. This video will explore the science behind low-carb diets and their potential benefits for those with diabetes and heart disease. Diabetes is a chronic disease characterized by high blood sugar levels. The main treatment for diabetes is to control blood sugar levels through diet and lifestyle changes. Low-carb diets have been shown to be effective in reducing blood sugar levels and improving glucose tolerance in individuals with type 2 diabetes. This is because carbohydrates are the main source of glucose in the diet, and by limiting carbohydrate intake, blood sugar levels can be better controlled. Low-carb diets have been found to improve insulin sensitivity, which is an important factor in managing diabetes. When insulin sensitivity is improved, the body becomes better able to use insulin effectively, reducing the risk of high blood sugar levels. Additionally, low-carb diets have been found to lead to weight loss, which is another important factor in managing diabetes. By reducing overall body fat and improving insulin sensitivity, low-carb diets can help individuals with diabetes better manage their blood sugar levels and reduce the risk of complications. Heart disease is another chronic condition that has been linked to a high carbohydrate diet. Low-carb diets have been shown to improve several risk factors for heart disease, including reducing bad cholesterol levels and improving insulin sensitivity. Low-carb diets have been found to reduce inflammation in the body, which is a key contributor to heart disease. By reducing inflammation, low-carb diets can help improve heart health and reduce the risk of heart disease. Another potential benefit of low-carb diets for heart health is their ability to reduce blood pressure. High blood pressure is a major risk factor for heart disease, and low-carb diets have been shown to effectively lower blood pressure in some individuals. By reducing blood pressure, low-carb diets can help reduce the risk of heart disease and improve overall heart health. However, it is important to note that not all low-carb diets are created equal. It is important to choose a low-carb diet that is balanced and includes a variety of healthy protein sources, healthy fats, and plenty of vegetables. It is important to speak with a healthcare provider before starting a low-carb diet, especially if you have a chronic health condition like diabetes or heart disease. In conclusion, low-carb diets can have potential benefits for individuals with diabetes and heart disease by improving insulin sensitivity, reducing inflammation, and reducing the risk of high blood sugar levels and high blood pressure. However, it is important to choose a balanced low-carb diet and to speak with a healthcare provider before starting any new diet regimen. By working with a healthcare provider and making healthy lifestyle choices, individuals with diabetes and heart disease can improve their health and reduce their risk of complications.